Hello, it's Dr. Rhonda Johnson, and today is Monday, December 28th, 2020. And today I'm going to be talking about knowing your why in terms of your personal decision to get the new COVID-19 vaccine. Now, I've been talking about tools in your toolbox. So today I hope to give you a set of tools by which you may want to consider how to use in terms of your decision, and also feel free to share this with your friends and family and colleagues, because after all, everybody's talking about this subject. You know, the COVID-19 vaccine has become so politicized, just like the pandemic, and sometimes we forget that this is just a personal health issue, not a political issue, certainly not a religious issue. It's just a health decision, just like you would make decisions around your blood pressure medication or any other medical problem. This is a voluntary vaccine, and really, I'm delighted to see all the people who are getting their vaccines and sharing their stories. But if you choose not to do so, it's perfectly understandable, because this is a health decision that belongs to you. But I certainly do understand the attention to this issue. So let's just back up a little bit and take a minute. COVID-19 is a medical condition. It's a potentially life-ending condition, because we know that worldwide, almost 1.8 million people have lost their lives to this virus. And here in the United States, 341,000 plus people have lost their lives due to this virus, more than any other country in the world, more than the populations of the cities of Pittsburgh or St. Louis. But if you don't die from COVID-19, you may also have what's called the long haul syndrome, serious disability, and that can be anywhere from chronic lung disease, heart disease, stroke, kidney failure, and impaired mental cognition. Other conditions may include short-term or prolonged erectile dysfunction in men, male infertility, significant hair loss, prolonged loss of smell, chronic fatigue, anxiety, and post-traumatic stress disorder symptoms. So, in face of all of this, I'm going back to the question, why? Why would you get the vaccine? Or why not would you not get the vaccine? And some tools to help you in terms of making your decision. So how about these three questions? Question number one, what are my known health risks? And health risks can include your medical conditions, because again, this is a medical illness, such as diabetes, high blood pressure, whether or not you're obese, if you have asthma, lupus, or other autoimmune diseases, if you're a cancer survivor, and a whole host of conditions that may make you more susceptible to complications from COVID-19. Then factor in your social, lifestyle, and environmental risks. That can include your race. You're more likely to die if you're Black, Latinx, or Indigenous. Your gender. If you're a man, you have a much higher likelihood of dying than if you're a woman. And what your work duties are. You know, whether you have the luxury of working from home and reducing your risk, or are you an essential worker out there every day in retail, manufacturing, safety services, water treatment, public safety. There's a whole lot of essential jobs. Are you a caretaker? Do you take care of someone who's sick or elderly or disabled? Do you live in a multi-generational household? Do you rely on public transportation or rideshare? These are some social, lifestyle, and environmental risks that you may also want to take into consideration. So our first question was, what are my known health risks? The second question was, what are my social, lifestyle, and environmental risks? And the next question is, what are my personal beliefs, fears, questions that I need to know that will influence my decision? So one little suggestion that I have is start from here. Start from today. Start from now. You know, we're about to start a brand new year, 2021. A new year, a fresh start. I really do believe in honoring the ancestral memories. And I will actually pause for a second to allow myself to honor the enslaved African man named Onesimus, who was purchased by a prominent Puritan minister, Cotton Mather, who introduced smallpox vaccination in the United States, saving countless of lives in Boston during a smallpox epidemic in the early 1700s. Very few people know this fact of American history, that it was an African slave who introduced vaccination and inoculation into American medicine here in the United States. You know, our ancestors, they had their struggles, but they did not have the coronavirus pandemic. So start from here, focus on the coronavirus pandemic today, now, 2020. Take the time to sort through all these important considerations about your religious beliefs and the questions that you may have, and write your questions down so you can focus on getting the answers. I know many people still want to know if it's safe. What are the long-term side effects? People say they want to see how it works in other people before they get theirs. What are the facts? What are the rumors? And folks, know where you should go for factual information, to a source that's reliable for you. Some people go to the CDC, their local health department, their personal care physicians. Some people use websites like the Mayo Clinic or WebMD. But whatever your source is, get the facts from a reliable source and try to get your questions answered by someone who knows the science, not the misinformation. After all, you know, if you want to buy a car, you go talk to somebody who knows about cars. If I want to bake a cake, I'm going to go talk to somebody who knows how to bake the cakes. Okay, so those are the risks. Now think about the benefits to you or to your family. So, you know, that old question, what's in it for me? What is in it for you? What are the benefits to you personally? You know, is it a benefit to decrease your likelihood of dying from COVID-19? Is it a benefit to keep yourself from experiencing serious illness for 4 to 6 weeks or experiencing long-term disability? Is it a benefit to increase your odds of living through the pandemic and having years of quality life? Is it a benefit to think about your life goals, such as birthdays, vacations you want to take, anniversaries, weddings, going to retirement age, getting married, having kids, completing some type of educational goals? What is that thing that you want to live to see and fully participate in? And then ask yourself, what are the benefits for the people who depend on you? You know, do you have any family responsibilities that you want to be able to live into and live up to? So please, folks, address these questions. Think about them. Address your fears, your thoughts honestly. Honor your process. Talk to people if this is what you need to do. And then lastly, it's important to know your place in the line because, you know, currently we don't have enough doses and there's prioritization. We are currently in phase 1, and that's healthcare workers, long-term care facility workers. And then we'll go into phase 2, which are first responders, people like teachers, school staff, public health workers, other essential frontline workers that regularly interact with the public, like pharmacists, grocery store workers, etc., transit employees, or people who involved in maintenance of the critical infrastructure, like the waste and water treatment facilities, etc. Then the third phase is folks who are over 65 and individuals under 65 with high-risk comorbidities and health conditions. Phase 4, individuals under 65 with high-risk comorbidities and health conditions. And phase 5 are healthy adults and children. That we don't know how long that's going to take, that whole process. So you have time. My whole point is you have time to be thinking about your decision. So that's it today. I know there's a lot of talk about these COVID-19 vaccines. I encourage you to make your decision using tools in your toolbox. This is Dr. Rhonda Johnson. My views are my own. Stay safe, folks, and have a blessed day.